For today's BC update of COVID-19, we have 45 new cases that tested positive, who tested positive in the last 24 hours here in BC, bringing our total to 1,336 people in the province who have a test positive. That includes 615 people in Vancouver Coastal Health, 487 in Fraser Health, 81 on Vancouver Island Health Authority area, 130 in the Interior Health area, and 23 in Northern Health. We have no new long-term care facility outbreaks. It remains at 21. However, we do have some new cases, and we're up to 226 people in long-term care or assisted living who have tested positive, including 138 residents and 88 staff. Right now, we have 135 people who are hospitalized in British Columbia. That's a slight decrease in the last 24 hours, and 61 people in critical care or ICU, and that as well is a decrease of 5 people in the last 24 hours. Sadly, we continue to have deaths from COVID-19 in BC, and there were 5 recorded in the last 24 hours, bringing us up to a total of 48 people who have passed away in British Columbia from COVID-19. And unfortunately, it continues to differentially affect our elders who are in long-term care, including 2 people who died for the first 2 deaths in Amica, Edgemont, one of the long-term care homes that has been experiencing one of the outbreaks, and an additional person in the Lynn Valley Care Centre. And our hearts as well go out to those people, their families, and the care teams in the long-term care homes who are doing so much to try and protect and care for people. We now have 838 people who meet their criteria for recovery and are no longer in isolation in British Columbia. A couple of things I wanted to bring up today quickly. You would have heard at 1:30 today that the Premier has announced that we are stepping up our partnership with our Canadian Border Service Agency and the quarantine service at our land borders, and we will work together to support each other to continue to ensure that we can flatten the curve of this outbreak here in British Columbia. And that includes making sure that we don't have gaps in our firewall. And part of that is ensuring that people who come back from traveling overseas, who have a risk of being exposed to COVID-19 because of those travels, are able to join our firewall to make sure that they have the means to do what they need to do to self-isolate for 14 days when they come back, to best protect both themselves, their families, and our communities across BC. So the piece that we are adding, you would have heard today, is ensuring that everybody who comes back has an approved self-isolation plan that they attest to and that they sign off on, and that we are there to support and welcome them and make sure they have the means and the things that they need to be able to adhere to this self-isolation plan. And that may mean for some people that they spend some time in our quarantine facility that we'll be partnering with the federal government on until the important pieces that they need are in place to be able to self-isolate effectively at home. For many people, for most people, I'm sure, it will mean that they go directly home and that we're able to support them by providing things like groceries, medications if needed, and other things to make sure that they are able to effectively and safely care for themselves and to self-isolate in their community. We also are going to be doing regular check-ins on everybody who is in self-isolation to make sure they have the things that they need to continue to follow the measures that we need them to take, and that they are able to be connected quickly to health services if those are needed, and they know who to contact should they have needs arise while they're in self-isolation. And I want to thank particularly the many community organizations and public servants across British Columbia who stepped up to be part of this initiative. It's a really important thing that we can do to welcome home our fellow people from British Columbia and make sure that they have the means to stand with us and make sure we're doing all that we can to continue to prevent transmission of this virus in our communities. I will also mention, as we're coming up to the long weekend, that we've said this before and we'll say it again. We need to stay home. this weekend. We need to be close to our families, to the people that we share our homes with, and we need to reach out to others virtually and stay connected. But this is not the time to take unnecessary travel. It's not the time to go to some of our smaller or more remote communities where the services may not be available to support you or to support the community should this virus be introduced into those communities. And we need to make sure that we consider the impact that such a misstep could have on everything that we have done and everything that we have put together in the last couple of weeks, and to make sure that we continue to keep our firewall strong. So we are in this together, and I said this week every day, we are in the thick of it right now. We are still watching what's happening across the country and across the globe, and it is no time for us to let up at all. And I want to thank everybody for who's doing their part, and others who may find this challenging. But this is the time where we can be together to support each other in being able to do what we need to do right now. And that's all about safe distancing between us, not connecting with people physically, but connecting with them virtually, making sure we're supporting each other, making sure we're doing the cleaning our hands regularly, covering our mouth, and staying away from others, particularly if we're not feeling well ourselves. So every day that we are doing this is making a difference. It's making a difference in our communities across British Columbia. And this is our time to continue that, to care for each other, to bend the curve together. And as Minister said yesterday, bend the curve, not the rules this weekend. It's a time to continue what we have been doing, being kind to each other, being calm, and being safe.